It is very comfortable. You don't even have to take your clothes off. You sit in this chair and you can feel these muscles contracting. No longer do patients have time for downtime.
If you've heard of the Longevity Bible Lifespan by Professor David Sinclair, you know that living well is more important than just living long. In fact, this show is dedicated to the science of beauty, wellness, and longevity. That's why I'm so thrilled to partner with Melrose Future Lab for Season 9 of the Ageless Radiance Club podcast. Future Lab is Australia's first supplement range focused on extending not just your lifespan, but your health span. Available exclusively at Chemist Warehouse, these affordable and science-backed supplements are the key to aging well. Welcome to our latest podcast episode, where we're going to explore the forefront of aesthetic medicine with Dr. Saras Sundrum, founder of Dr. Saras Co clinics and a leading aesthetic practitioner. Dr. Saras, who holds an MBBS from the University of Sydney and is a founding fellow of the Cosmetic Physician Society of Australia, has been pioneering in the field of cosmetic medicine since establishing her first clinic in 1997. Today, her practice includes several clinics across Sydney, specialising in a range of non-surgical and non-invasive procedures. In this episode, Dr. Saras will discuss the integration of cutting-edge technologies like EMSCULPT, EMSCULPT NEO and EMFACE in her practice, focusing on how these innovations enhance body sculpting, muscle tone, and facial rejuvenation. We'll delve into her multimodality approach to treatment, which aligns with modern technologies with a personalised patient care approach to achieve natural and effective aesthetic outcomes. Join me as we uncover the effective strategies for addressing common aesthetic concerns, including those related to menopause, and learn how advanced technology is transforming patient care in the aesthetics industry. Dr. Saras, I'm so happy to have you on the show. It's been a long time in the making, this one.
It has. I'm very excited as well. Thank you, Bada, for asking me.
You know, I'm really happy to have you on the show because I feel like this is your area of expertise. What's happening in the aesthetics world at the moment is this big move away from single strategies to multimodality clinics and multimodality services that are being offered. And I feel like there are some clinicians and practitioners who've always invested in lots of technology, lots of different approaches. And there are some clinics that are just like, we have this device, we're really into it, you're going to love it. And when I first met you, and I want to say that was about 4 years ago, you've got 2 practices. I've been to 2 of your...
I've actually got 3, but the third one doesn't have as many devices.
But that's what I was going to say. I was just absolutely gobsmacked by your investment in technology. And I thought, okay, she's a serious believer in the science of things. So I'd love for you to share the background of how you came into aesthetic medicine and what the philosophy of your practice is.
I actually became an aesthetic doctor quite early on, almost about 30 years ago. So I just finished my hospital training and I was attracted to this area because it was exciting. It was almost like every new week there was a new treatment, a new device, a new way of looking at things. And that, I think, was what interested me. So even then, I was interested in technology. So the other thing that I could possibly say is different about my practice compared to other practices is that very early on, I realized that no one treatment or no one device has all the answers. Whatever the company says, whatever the patient says, that they only want that, it's just not going to do it. It will do what it does best, one thing best, and it might do, a few other applications, but they will not be done very well. So to give your patients the best overall result, you do have to mix and match. And which devices you use, where you direct the patient depends on the patient. And so very early on, I knew it couldn't just be one treatment, one technology. You really had to do the research. You had to do the hard research and find out what was there. I rejected a lot of technology. So it's not about investing in every new technology that comes out. You have to do the research and find out, is it any good? Is it going to suit your patient population? And I've rejected more than I've actually embraced. So that's a very important point to note. So
As we were saying at the top of the episode, the trend is towards this multimodality approach, more natural aesthetics, aesthetic treatments that are going to improve your skin quality seem to be the ones that everyone is really excited about. And to your point, you have to be very judicious in what technology you bring into the clinic, and it has to match your client demographic profile. Can you tell me, in this past 30 years where you've been working in aesthetic medicine, what's changed in the client profile of someone who is seeking aesthetic services?
Yeah. Well, we have a much smarter patient coming to us now. They are an educated patient. They've done the research. They are demanding certain treatments. So we have to keep up, which is great. It pushes you to do the hard work. You cannot be that lazy clinic which has, which is still giving that same old one treatment to the patients over 30 years. You have to improve. Our patient now has done the research, they know what they want, and they are willing to invest. That's the big thing that's changed. They are willing to spend their money on their bodies, their face, wellness, but they want value for money. So you have to deliver the best. The other thing is no longer do patients have time for downtime. That's important. A lot of our treatments now, I can't sell a treatment that has a lot of downtime anymore. They don't want something that's going to be long treatments, many treatments. They want something that's quick and efficient. So, that's the type of patient we're dealing with. And I think I've noticed probably in the last 5 to 10 years, we've caught up with them. Our clinics have changed. We are delivering in a different way. And it's all good news. I think this is the way we should evolve.
One of the reasons I specifically wanted to have you on this show, and this episode is in partnership with BTL Aesthetics, which is how I first came to know your brand, is that I feel that you were a very early advocate of what you do for the face. You should also be investing in your body. And
Yes.
I have actually never heard of another aesthetic practitioner with your level of expertise of what happens below the neck. I feel like everyone dabbles in a little bit of body, but there is no aesthetic practitioner. There are lots of body clinics, but there's no one with a doctor led practice that's saying, you don't stop aging at the neck. What are you doing for your arms, for your legs, for your buttocks? What are you doing for your pelvic floor? What are you doing for muscle atrophy? What are you doing for bone density? And those are the conversations that you seem to have that no one else is having in an
Yeah,
aesthetic practice.
yeah, that's probably true. It's probably true. And this led from my early adoption of body treatments. Some of your listeners might remember the fat freezing that started about 20 years ago with various different devices. So I was an early adopter of that. And that grew to different other radio frequency ultrasound machines. But I got very excited when BTL arrived in Australia, probably about 5 years ago, because I'd done the research and seen what they were offering people elsewhere in the world. And I think we started with the Emsella, and I was very excited about getting an Emsella. I got Gareth from VTL to come around, and that is an amazing device. It still is one of the most popular devices in our practice. Strengthening the pelvic floor because it's universal. So many of our patients can benefit from it, male, female, young, old. And then this grew into their star performer, EMSCULPT and NEO EMSCULPT, a device that can tone and firm the muscles. And now we can use this anywhere in the body. Is something that we could not do before. And that's why it was so exciting to introduce BTL devices into our practice.
I want to talk to you about something that, again, is sometimes ignored when we talk about aesthetic practice, and is what happens to the body as we age. Again, there's been so much focus on what happens to our faces when we age, what happens to the things that are really visible. But I'm wondering if you could share with us, in your clinical experience, what you notice in men and in women, the redistribution of fat, muscle, strength, functionality. What are some of the things that you see in your patients that you have been treating over length of time? and then why you think that aesthetic intervention is as valuable as any other intervention.
So as we age, I think most people will see the differences in the face, and that's where they have stopped previously. But what we have to realize is that as we age, especially over the age of 30, we lose 5% muscle mass every decade. That is huge because what we have learned about health, function, posture, youth is that we must maintain that muscle mass, that muscle mass density, because this is what is going to improve our muscle to fat ratio, is going to keep our metabolism at an all time high. So it was BTL that we decided to focus on maintaining this muscle mass, because that is the key to having a youthful, efficient, functioning body. And now we can do it on the face as well, but we'll talk about that later. But
You know
I
what's interesting is that you're not talking about weight loss and fat loss anymore.
no,
You're
no,
talking about functionality, strength, posture, youthful gait. And I think that's part of the evolution of aesthetics is that it now has a health element that I think, certainly my readers and the people who are listeners will always say, but is it healthy? Is it safe? Does it make me mobile for longer? Does it make me recover faster?
exactly. That's what we need to concentrate on, because it's not about, if you looked at some of the 1950s actresses, they had these faces that didn't move, that looked painted, but their bodies, their functionality was hopeless. And they usually died a very, short lived life. But now our patients want to be functioning, not only just looking good, but functioning well into their 90s. And that's where some of these devices have become so helpful. So it's not just about youthful skin. And we have other devices for that, plus some of the BTL devices, but it's the other layers, the fat compartment, the muscle compartment, not just the top level skin. So very, very important.
Can I ask you to explain to me what the two devices you've mentioned are? What is Emsella? What does it do? And you mentioned some of the things that it does for core strength, but I'd be interested to see what else you use it for in your practice.
So the Emsella was one of the first devices utilizing high FEM, which stands for high intensity focused electromagnetic energy. And we use this energy, we focus it onto our muscles, in the case of the Emsella device, on our pelvic floor muscles. And it is very comfortable. You don't even have to take your clothes off. You sit in this chair and you can feel these muscles contracting. And these supramaximal, more than 20,000 contractions, in a 20 minutes period is what strengthens those muscles. So it takes it back to its youthful condition. And this is so useful for so many different things. It's not just outright incontinence. It's strength of that pelvic floor so that, when you're sneezing or exercising, you don't have little accidents. It's great for sexual health as well. It keeps the muscles functioning as well as possible. And this is, in the case of men with erectile dysfunction as well. So it really is sexual health in all its components. And so I love the device because it's relatively simple. It's not threatening. It's not scary to our
It's so
patients.
comfortable.
And
I've done it a few times and I love it. It's
yeah,
relaxing.
yeah, I actually go and sit on it at the end of the day when the whole team's left and I still have some paperwork to do, and I'll just go and sit on it. Why waste the time? So it's been a great hit. And that led me to inquire about their other devices, which we love. And one of the stars is the Neo EMSCULPT. And the Neo EMSCULPT has been a great hit at both our practices because it does something that no other device could have done, could do. And it's really two devices in one. We've got the high FEM technology that comes out of the paddles, and now we can use it on almost every part of our body. And what this high FEM technology is doing is toning and firming the muscle layer of our body. And by trying to get these muscles contracting supramaximally, we actually burn some of the fat around the muscles. So we're having reduction in fat and increase in muscle density. This is combined with radio frequency, which simultaneously comes out of the paddles at the same time that the high fem technology is coming out. And you get further fat loss. It also helps to tighten the skin because radio frequency is going through the skin as well to tighten that top layer of skin. So a great hit. It's not just the abdomen and the buttocks that we can use it now. We can use it on arms, biceps, triceps, quadriceps, buttocks, as I mentioned before, calves, love handles. We've got it all. So the one device, which has really, really been helpful.
I want to ask you about some of the musculoskeletal symptoms of menopause, because one of the key topics that's being thrown around at the moment is exactly what you were saying before, that uh, 5% muscle loss in each decade, muscle mass loss. But then after menopause, when estrogen essentially exits, the decline in muscle loss is quite extreme. And there is a lot of pressure to start using weight bearing exercises to change the way you train functionality to increase your muscle mass. And I want to ask you, if someone is, at any age, say they're either recently in menopause or postmenopausal, is this device suitable for helping fast track that muscle redentification and building muscle mass?
It is. It is. And so you can, the wonderful thing about the Neo Sculpt, you can use it. So the great thing about this device is that it covers all types of patients. You can still use it on a patient who's never exercised before. And we need to use it on that patient. We need to maintain the muscle that she or he has. But you could also use it on a woman who has exercised, who's particularly fit, because they want an even more efficient toned, sculpted body. Okay. So for the patient who is going through menopause, perimenopausal, her functionality is very important. We want a stronger, fitter muscle core on her because this is going to help her, make sure that her osteoporosis, which is also something that happens with menopause, doesn't overwhelm her body. So she's got the muscles to support her so that she's not accidentally falling, things like that. So it really is impacting on all areas of health. So if we can start with that muscle, we can help everything. So,
So you were talking about what the technology is, and I want to make it kind of clear, because if you've never seen what EMSCULPT NEO is like, you might have in your head that it's like tensor technology where it just twitches, but it's not. Exactly
it's
as you
not,
said,
it's not.
it's so much more than that. And one of the things that I have seen it successfully used for, I think the syndrome is called dead butt syndrome, where the muscles in your butt have really stopped working. And with the paddles on, it can, like, a lot of physios recommend it, a lot of people who are working with elite athletes, or people who've had bed rest, for example, or
Exactly.
postpartum, where you haven't had that great mobility or exercise. It can be a fast track to building the strength of your glutes so that
Yes.
you have better mobility. I'm wondering,
Yes.
can you use the EMSCULPT NEO without the fat loss? So you just doing muscle gain? Ready to meet your best self? FutureLab supplements available exclusively at Chemist Warehouse give your body what it needs to stay strong, radiant, and ageless. FutureLab's longevity trifecta, NAD+, berberine, and resveratrol work to support the hallmarks of aging from the inside out.
Yes. Yes, you can. And this is particularly important when we're treating the glutes because we don't want to lose fat in that
That's
gluteal
right.
area. Yes, particularly. And so the great thing about this device is the programs are defined depending on what area you want to treat. So the practitioner doesn't have to worry about it. We just have to select the area that we're treating. And so for the glutes, we're concentrating on muscle, improving muscle mass and muscle density. We don't want to damage fat. Whereas with the abdominal treatments in other areas, yes, we do want to damage fat. So different protocol, different programs. So very important.
Does it help with cellulite as well?
No, EMSCULPT NEO does not help with cellulite. Cellulite is a completely different beast, and there are other devices that are very good. But the EMSCULPT NEO, as we were talking before, one device can't do it all. So, you do need to have your practitioner know what a device can do and what its limitations are. And that's where that whole multimodality comes in. So, in our clinic, we have devices that help muscle and reduce fat, but we have other devices that are going to help the cellulite improve.
I'm going to ask you now if there's an equivalent that you use in your practice for the face and what you recommend for that lifting, tightening, redensifying that may happen at that midlife for men and for women. Because I know your practice is actually almost split evenly. Is that correct?
Pretty much,
Yeah.
yes.
Which is pretty
That,
astonishing. That's
yeah, I think, but it's also because the type of patient is changing, what they want is changing. So, I mean, let's go back to what I see, what trends we see out there. I really think there is a trend away from the frozen, overfilled face. People are now realizing that the frozen, overfilled face is not necessarily more useful or more attractive. We now know that looking more youthful, but achieving a more natural way of doing it is the way to go. And that is where my latest device, the M Face, comes in.
you've got
Because
in
really,
face as well.
yes,
I loved it.
is the equivalent of Neo M Sculpt for the body. And M Face is concentrating on lifting our muscles of the face to where they were when we were young. Okay. It's not about overfilling the face with fillers or freezing every muscle with toxin. And when you think about the use, the aging process, when we're talking to patients and they come in and they go, Doc, what I want is that. So what are they talking about? They're talking about those muscles and also the fat dropping and producing these jowl areas. So Enphase is trying to bring the muscles back to where they were in their useful state. It's about improving the skin over the muscles. It's about dragging that fat volume back up there where in the cheek area.
My
So
cheek area popped. When I
yes,
had face, my cheeks
yeah.
literally go up. And they look
You can see it.
fuller.
You can see it.
Yeah.
Yeah. It's that forward projection as well. And I love the contouring. It's a very natural look. Whereas sometimes when you see patients who've had filler for too long, it's this unnatural balloon. It isn't attractive. But with M face, you can't actually make a mistake. It actually takes you back within your parameters. So it's still you. It's not somebody else's face. A
So if you're a
brilliant.
bit needle phobic or if you don't want to have any sort of
Exactly.
invasive, you could try this.
Exactly. Exactly. So that's where, when you were talking before about multimodality, you might have a patient who can use M-Face along with their injectable treatments, or you can have a patient who does not want any injectable treatments, and we've got the M-Face to offer her.
Can I
So
ask you what you would use what other devices you would recommend for the face? Because on the topic of multimodality, do you also combine lifting and tightening with laser, with
sure,
yeah,
sure.
do you do that combination therapy
All
in
the
your
time, all
yeah.
the time. So, lifting and tightening may not treat pigmentation or vessels. So we need to use a vascular laser or a BBL, which you can use at the same time. We also have to advise on skincare. I mean, one device does not do it all. They need, constant revision of their skincare. Some of the things I might combine just for skin improvement of the face are the radio frequency microneedling as well. Again, you can do that with M-Face. So it goes hand in hand with a lot of different technology and a lot of treatments.
I want to ask you your thoughts on the topics of regenerative medicine. What are your thoughts and experiences with the new boosters, the exosomes,
Yes,
the things that are like the Rejuran and all of those biostimulators? Are you excited as a
I
practitioner?
am. I
With
am very excited because I think it's going we're getting closer and closer to what youth is. And I am always loved the natural results. And I think these new treatments are going to give us more of a natural result. And they're easier. They're not as risky. They're not as scary, very easy to administer. So I think all these devices go hand in hand with some of these exosomes, some of the biostimulators. Very important to combine them all.
Um, when you said something earlier that definitely caught my attention. You were saying about the highly educated consumer that's coming through. And I totally agree with you. I always refer to my audience as citizen scientists. The
Yeah.
questions that I get are so like educated, interesting, deep. And, I'm often compelled to like look things up because of a question that one of my audiences posed. And I think,
Yeah.
wow, like you're really invested in the science of this.
Yes.
But I also think that there's a level of caution that I would apply. And I do say this to people who DM me and say, what do you like? What do you have done? And I get maybe 30 of those a day where people want me to tell them what I've had done or what do I recommend. And there's a part of me that, is excited that there's all this consumer discourse, but there's another part of me that thinks, okay, you're obviously getting your education just off social media. This is a conversation you need to be having with your practitioner.
Mm.
What
Mm.
happens when, as a practitioner, when you get one of these clients or patients that comes in that knows everything and, wants to have this, and this? How do you kind of pull it back and then apply your own expertise, experience?
Yeah. Yeah. I mean, look, there's nothing wrong with an educated patient. I want people to have invested a bit of time in what they want. But at that first consultation, it is very important not to just point blank tell them that what they think a treatment is all about is not the case. You want to develop a relationship. You want to develop that trust. So on that first consultation, I basically do this for almost all my patients. I observe. So they're sitting down next to me. I get them to talk and I'm observing their face. I'm observing what moves. Is there any asymmetries? I'm formulating in the back of my mind what I would do for them, but I'm not telling them. I want to hear it from them. So the next thing, other than observation, is listen. Listen to what they're saying because you'll pick up a lot of clues, which will direct you into better directing them. So, they will tell you what they might be afraid of. They might tell you what they really want to have, or they might tell you they want it for a particular Saturday night and not for the next 25 years. So all these things will alter the way you go about planning a treatment for them. And then, they might want to tell me that they know everything about it. And I say, that's brilliant. That's great. But I just want to tell you that that particular point isn't the case. And I think if you're gentle and you've listened to them and you've spent the time, they react to you telling them that they might not have all the answers quite well. Quite well. They think of it as a partnership. I love my patients taking ownership of their treatments. It never works if the doctor just goes, you need bloom, 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 and that's it. You need your patient to take ownership and they enjoy the treatment session so much better. If they sort of made a decision with you. I mean, we love spending time with our patients. And I think that's why we keep patients. I mean, I have patients who've been coming to see me for 25 years. I'm very proud of that. And you don't get that overnight. You really have to have a genuine honesty with them and they have to be able to trust you. And that just takes time. You just need to spend the time.
What do you think of PRP?
I'm not a big fan of PRP. Again, it comes back to downtime. It's a little bit painful. It is an injectable. I think it's been superseded by some of our new exosomes that are coming on the market. I'm very into that. I think that's the frontier. That's the future. So some people love it. I'm not a big fan of it. There is the downtime. There is the pain.
And do you prescribe any regenerative medicine or supplementation in your clinical practice? Because I know
We
that when we've spoken, we've talked about the more macro longevity, long-term beauty and wellness aspect of it. I know you're really interested in that.
the basics. This is one area that this year we're really getting better at it. My team of dermal therapists and I are we're researching it because you have to be a little bit careful about recommending things. You really want to be on top of it. And there's been a lot of new advances in this field. And so we want to get it right. So absolutely, this is the way it's going. It's going to be hand in hand with some of our old, well-tried treatments. I don't think you're doing justice to your patients unless you do recommend nutritional supplements, skincare supplements, the new exosome supplements. It goes hand in hand.
Can I ask you, given that you are a bit of a tech nerd and tech investor when it comes to
Mm.
beauty, I've seen you walk through the halls of these conferences and all of the companies, their eyes light up because Dr. Saras is in the hall and that, you've got your checkbook out and you're at, and I have to say for the listeners who are, these investments, like Dr. Saras would have the equivalent of a couple of houses in her
Yes, they do take up a lot of space, I have to
no,
say.
and they cost a bomb, like
Yeah,
a good
you
buy's
want to be using them.
few hundred
You want to be
thousand
using
dollars.
them. Yeah,
Yeah, and they're good and they're expensive. So doctors don't buy things that they don't believe in because they cost a lot,
you can't
right?
afford to. You can't afford to. You can't afford to buy a machine and keep it in the corner gathering dust. So again, as I said before, I think I reject many more devices than I buy. My other you know, bias is that I tend to, as I'm growing older, I tend to buy devices that I want to use on myself. That's my other bias in terms of what I choose. But I love new technology. I mean, this field, above all other medical fields, I think, has something new and exciting almost every month. You just have to research it. You have to find out what it's about. And fortunately, I'm in a position, I have a very good relationship with a lot of these companies, and they allow me to trial it out and they're there to educate me. So it's been fun.
I want to finish on one topic that's a hot topic, and that is
Yes.
Ozempic face and Ozempic body. I think Ozempic is a generic term, so please forgive
Yes.
me, Ozempic. I don't mean to be disparaging, and I know that it's a super helpful medication for a lot of people who have diabetes, who have obesity issues, and there's a host of things that's coming through on the research of all the other benefits. I'm not putting it down. But I do concur because I've experienced rapid weight loss before, and what it does to your face and body is actually quite terrifying. Like it can hit you real fast, and before you know it, and it can be in a matter of months. You can go from having full face or firm skin on your body to a body or a face you almost don't recognize. And I'm
Yes.
wondering in the aesthetic space, what is the talk amongst doctors and professionals about this wave of the population that's going to need support here?
Yeah, it is a little disturbing because it's becoming an increasingly bigger proportion of the population that comes in. I see my patients almost regularly, what, 3 times a year, twice a year. So I'm seeing them regularly over many years. And I have a lot of them who have gone and tried one of the weight loss drugs that have appeared. And, they love the loss of weight, but they have remarked about the ongoing problem. So you've got that laxity of skin, you've got the jowl appearing. So they will be seeking out other treatments, but in a lot of cases, the only treatment will be outright surgery because some of the amounts of weight loss have been huge. So some of our devices do have a limitation. You cannot just laser away excessive skin, crepey skin. It needs to be cut out. So it's a little bit alarming, but I'm sure we'll address that problem as it becomes bigger and bigger.
If you were to kind of look into your crystal ball, and I would say the aesthetics industry is changing so fast. I'm not going to say 10 years. I'm going to say in the next 2 or 3 years, if you
Yes.
were to make a prediction about what the future of the aesthetic industry is going to be, what are some of the key trends that you think are going to manifest as everyday parlance or everyday treatments?
Well, there are two things that I sort of think might happen. I think men are the new frontier. This distinction between women being the cosmetic patient is going to change. It's going to be an equal division. Men and women equally are going to demand cosmetic procedures. The second thing is that cosmetic procedures are going to go hand in hand with wellness. So all our clinics are going to have to deliver wellness, regenerative medicine, functional medicine. It goes hand in hand. We can't avoid this. So we're all going to become experts in wellness, which I'm looking forward to because I'm interested in finding out a lot about these things because I think that's what our patients want. So that's that's going to change. It's not going to be outright surgery or outright injectables anymore. Our patient populations demand more. So I would probably pinpoint those two things. I think, fillers are going to be less popular. I think we're already seeing that. And surgery probably is going to become less popular. People are going to take care of themselves a little bit better so that they don't require surgery in their late 50s and 60s and 70s.
Well, this was a wonderful conversation, and I want to thank you so much. I know how
Thank
busy you are
you.
with your multiple clinics, and for you to put time aside for me is wonderful. And I look forward to seeing you again. I'm so sad you won't be at our event because you'll be overseas.
Oh, I think
I
it's
know.
going to be brilliant. I think it's going to
Yes,
be
and I was
brilliant.
really hoping to have you speak at the event. So
Next
next
time,
time, for
next time.
sure, for sure. And Dr. Saras, such a pleasure and
Thank you.
honor to have you on the show. I really appreciate your insights, and I always love speaking to you. Very frank and very fun, I would say.
Thank you so much for having me. It was a great deal of fun. Thank you.
Thanks for listening. If you enjoyed this episode, please subscribe to the channel, sign up for our free newsletter, and consider leaving a review and rating it. This really helps the channel grow and reach new audiences.